السلام عليكم ورحمة الله وبركاته طلبة المرحلة الرابعة. اليوم محاضرتنا حول الأوتولارينجولوجي أو ENT سيرجري، الأنف والأذن والحنجرة، أو أحيانا يسمى الهيد and neck سيرجري. Otolaryngology, more commonly known as ENT, ear, nose and throat surgery, deals with conditions affecting the head and neck and the upper aerodigestive tract and organs of special sense. Techniques for examination in ENT. The ENT practitioner can see most of the organ and areas of interest, even areas that are not easily or directly visualized, such as the larynx, paranasal sinuses, can be examined indirectly using specialized instruments such as mirrors and endoscope. عندهم mirror أحيانا مثل الميرور مال طب الأسنان بس شوية تكون أرفع وأطول. Traditionally, the pharynx and larynx have been examined using mirrors and headlight illumination, and recently fiber optic and rigid endoscopes have been used for such examination. أول ما نبدي لابد أنه تصير عندنا معلومات حول emergency situations. The most challenging clinical situation is a patient with a sudden severe airway obstruction. Although this scenario is fortunately rare, and it's important that clinicians operating in the oral cavity and pharynx have an awareness of possible causes of acute airway obstruction and should have the necessary equipment to overcome such situations. كن شفتوا اكو فيلم فيديو بالفيسبوك واحد طيب اسنان دا ياخذ طبعه المراجعه وصار عندها airway obstruction. how we can manage such situations. The laryngeal airway is a narrow and functionally complex system whose most important role is to separate and protect the airway from the digestive tract. The diameter of space between the vocal cords is such that even small foreign bodies can cause severe and life-threatening airway obstruction. This risk of airway obstruction is greater in children due to the relatively small dimensions of the juvenile larynx and the natural tendency for children to put toys, beads, pen lids and other objects in their mouth. طبعا larynx in child يكون relatively small, and even the gap of the vocal cords is also small in relation or in relative to the adults. Acute airway obstruction. Sudden complete laryngeal obstruction is easily diagnosed as a severe respiratory distress, is rapidly followed by cyanosis and collapse. However, laryngeal obstruction is incomplete and signified by less dramatic increase of the respiratory effort, difficulty of speaking, and stridor. Stridor is a coarse inspiratory noise produced as the patient attempts to inhale forcibly through a narrowing and at the level of the larynx. Stridor is easily distinguished from other sound, which is a rattling, gargling noise produced by soft tissue obstruction or retained secretions at the level of the oropharynx. Immediate management of laryngeal obstruction. Emergency management depends on the degree of obstruction and the level of expertise and equipment available to deal with it. Of these techniques, only Heimlich maneuver and the laryngotomy are appropriate to non-specialist settings. Endotracheal intubation and tracheostomy require advanced skills and instrumentation. Heimlich maneuver or Heimlich maneuver is a technique for relieving airway obstruction caused by an impacted foreign body. If the patient can cough or speak, then the airway obstruction is incomplete and the Heimlich maneuver is not appropriate. Stand behind the patient with the arms encircling the patient's abdomen and crossed at the level of the patient's umbilicus. A forcible thrust upwards and backward is used to compress the patient's abdomen in an attempt to push the diaphragm upward and expel the lodged foreign body. هناك خطأ foreign body. الهملخ مانوفر هو انه تلزمه encircling the patient عند منطقة السرة and you press it forcibly inward in order to expel حتى يطرح الفورن بودي obstruction. احيانا اذا المراجع بوحده ممكن ينتشي يعني يستند على كرسي in behind ويسوي forcible inward movement حتى to expel this foreign body. الطريقة الثانية حتى نعالج الاختناق هو اللارyngotomy. An emergency surgical opening into the airway below the level of vocal cords has to be created. The cricothyroid membrane provides an anatomical window for gaining access to the airway. Anesthesia may not be appropriate by the time a decision is made to perform laryngotomy, and the patient is usually semi-conscious. For laryngotomy, full extension of the neck is essential. If the subject is a child, lay the patient across the knee of an assistant with the neck hyperextended. نرجع رقبته لورا and firmly palpate the midline structures of the neck. Starting from the prominence of the larynx of the thyroid cartilage, run a finger down the midline until a prominent ring of the cricothyroid cartilage is palpated. Above the cricoid ring and below the lower border of thyroid cartilage lies the cricothyroid membrane, and an incision is made to permit and to facilitate breathing. ها هي structures lie in the midline of the neck. هنا عندك thyroid cartilage, cricoid cartilage وبيناتهم الcricothyroid membrane. هنا حتسوي الانسجن in order to permit respiration. So with the neck sufficiently extended, there are no intervening structures between the cricothyroid membrane and the skin. Then a wide bore needle or cannula can be inserted through the membrane into the airway, and this may be sufficient to temporarily relieve the obstruction. A horizontal stab incision is made using a knife or scalpel. Without withdrawing, the blade is turned through a 90 degree to open the incision. Once the cricothyrotomy has been performed, it can be held open using a small tube, and in some extreme situation, the outer cylinder of a pen has been used to be with success. حتى لو تحط فت قلم بس to permit respiration. Specialized cricothyrotomy sets, which include a small bore endotracheal tube and a specially designed scalpel, and commercially available. موجودة هاي بمكاتب التجهيزات الطبية. General dental practitioners and others carrying out procedure in the oropharynx region in non-hospital settings would be well advised to purchase a cricothyroid kit and keep a small emergency tray in their clinic to overcome such situations. Other conditions affecting the head and neck region or ENT specialist ENT region هي البناين condition of pharynx. عندنا النيزوفارynx. النيزوفارynx is often involved in the upper respiratory tract infection. أول وحدة most common infection شنو عندنا؟ common cold is usually associated with nasopharyngitis. Symptoms of nasopharyngitis consist of discomfort, pain associated with swelling, and lymphoid tissue, which leads to nasal obstruction, and serum mucinous secretion, more commonly referred to as catarrhal inflammation. وهاي إذا تتذكرون أخذناها بأنواع الانفلامation في أول محاضرة. Nasopharyngitis is usually a self-limiting condition, but in some patients, chronic low-grade inflammation can occur, leading to nasal obstruction and chronic catarrhal inflammation. In children, the nasopharyngeal tonsil or adenoid can occupy almost all of the nasopharyngeal space. So acute respiratory infections can cause an acute adenitis and mucopurulent post-nasal discharge, nasal obstruction, and fever. Such episodes of acute infective adenitis are common in childhood and may lead to chronic adenoidal hypertrophy. تكبر هاي الليمف نودز تسوي لك nasopharyngeal obstruction للسبيس الموجود, will allow for mouth breathing and chronic mucopurulent postnatal discharge. The position of the Eustachian tubes of the hypertrophied and inflamed adenoids is thought to be important in the causation of middle ear effusions. The adenoid may therefore be important in most of the causes, causing hearing impairment in child, otitis media, التهاب الأذن الوسطى, with effusion more frequently known as glue ear, الأذن الملتصقة بها كأنه صمغ. فهاي من تكبر الادينويد الليمف نود شو تسوي؟ تبدي تضغط على الاوستيكيان تيوب، فمن الممكن تسوي لك التهابات الاذن الوسطى. مثل ما نشوف هنا هذا هو النيزوفارنكس سبيس وهذا هو الاوستيكيان تيوب. طبعا من الملاحظات اللي نشوف بالادينويد هايبرتروفي يكون وجه المراجع شويه بطول بيل، usually mouth breather، لذلك ايضا من العلامات الاخرى اللي نشوفها يكون عنده كروس بايت بالدنتال ارش. Other benign tumors of nasopharynx, tumors of the nasopharynx present with symptoms that can be confused with adenoid enlargement or nasal obstruction. Thus, a high index of suspicion is required and all cases should be undergo nasal endoscopic examination. Juvenile nasopharyngeal angiofibroma is a benign vascular tumor that occurs in adolescent males. It presents with a unilateral nasal obstruction and epistaxis مع نزف من الأنف. الأوروفارينكس condition، هذيك تكلمنا عن النيزوفارينكس، الآن الأوروفارينكس. Acute infective oropharyngitis present as a sore throat, pain on swallowing, and fever. The cause is usually viral and the condition is self-limiting, responding to asymptomatic measures such as paracetamol, saline gargles, and high fluid intake. Throat swabs seldom yield any significant growth. Severe non-resolving pharyngitis should raise the possibility of glandular fever. Often the cause can be ascertained or confirmed by their appearance to be association with nasal diseases. The treatment of chronic pharyngitis involves identification of the cause, treatment of any nasal disease, increased fluid intake, avoidance of antibiotic. These can sometimes lead to secondary candidosis. In some cases, topical nasal steroid sprays can help to reduce the inflammation. Other conditions of oropharynx هنا التهاب البلعوم، والآن نجي إلى التهاب اللوزتين التونسيلايتس. Acute tonsillitis is a common cause of sore throat, although the initial organism may be viral. Superinfection with Streptococcus usually occur. Tonsillitis can also be a complication of glandular fever. The symptoms are sore throat, pain on swallowing, adenophagia, systemic malaise, headache, fever. And because of pain on swallowing, patients tend to avoid eating and drinking and therefore can become pale. The patient become pale. Diagnosis is usually obvious with trismus, tonsillar hypertrophy, pus available on the tonsillar crypts, and there will be associated with a cervical adenitis. Treatment involves high fluid intake, analgesic, and penicillin. In severe cases, the patient may be unable to swallow oral antibiotics. Thus, a short course of intravenous benzyl penicillin may be indicated. Complications of tonsillitis include peritonsillar abscess or quinsy. تصير abscess ويلم بها قيح جراحة شديدة مثل ما نبوع عيناه بالصور whitish abscess upon the crypts. طبعا هاي اللوزتين يكون بها مثل الأخاديد أو خندق أو تشققات فنوبات المايكرو أورجانيزم يفوت deepened in these crypts. تضطر إذا ما استجاب إلى البنسلين after slight relief for it you have to make tonsillectomy. Tonsillectomy used to be an extremely common operation and was often used incorrectly as a treatment for non-specific sore throat pharyngitis. Tonsillectomy is carried out by dissecting the tonsils from their fossa and ligating and any bleeding points encountered in this area. The most frequent major complication is post-operative hemorrhage لأن نوبات يضرب branches of facial nerve which occurs in approximately 2% of the cases. Minor secondary tonsillar hemorrhage can also occur in 2 weeks after the operation and is usually managed conservatively using antibiotics and saline gargle. Indication for tonsillectomy. Current indication for tonsillectomy include a clear history that the sore throats are due to tonsillitis on 5 or more occasions per year over a period of at least 1 year, or evidence that these episodes of sore throat are disabling and preventing normal functions at school or work. Patients often complain of a white yellow lesion on their tonsils and they are foul testing ريحة عفونة and may be associated with halitosis ريحة فم مو طيبة. Examination shows numerous white granules occupying the tonsillar crypts and these are often diagnosed incorrectly as food debris. So indication for tonsillectomy الابسوليوت indication هو recurrent infection, peritonsillar abscess, tonsillitis causing febrile convulsion, hypertrophy causing obstruction, suspicious of malignancy. هاي absolute لازم تتدخل بيها. الريلاتيف مثلا يصير عنده diphtheria, streptococcal infection, chronic tonsillitis, recurring streptococcal tonsillitis in patient with certain heart prosthetic valves. ممكن هذا القرار يكون القرار للسيرجن or as part of another operation as palatopharyngeoplasty, glossopharyngeal neurectomy and removal of styloid process as in cases of eagle diseases. طبعا شو يسوون بالعملية؟ يستعملون جيلوتين مثل المقصلة في الآلة بها من تضغط مثل المسدس بس هذا المسدس من تضغط عليه يحرك مثل الشفرة أو السكالبل فهذا يحصر التونسل ويضغط على هذا الجليتون يقطع التونسلز from its base. So in dissection, an incision is made in the mucosa of the anterior fold immediately in front of the tonsil, and the gland is then freed by blunt dissection until it remains attached by only a pedicle of vessel near its lower pole. And this pedicle is then crossed and divided by means of a wire ويحصرها شلون ما يرفعون الرانيولا يحصرها حتى بنفس الوقت هم يقطعها وهم يسوي لايجيشن للبيز مالته. أو second method هو using of a glyton. الجليتون اللي هو المقصلة is applied so that the tonsil bulges through the ring of the instrument, and the tonsil is then removed by closing the blade of the guillotine. Unless there have been repeated infection, the superior constrictor lies separated from the palatine tonsil and its capsule by loose areolar tissue, which prevents the pharyngeal wall being dragged into a danger during tonsillectomy. Also لازم الoperator or surgeon يحط في باله انه there is a close relation with main vessels such as internal carotid artery حدود 2 centimeters behind the tonsil should be take a good precaution to prevent damaging of this vessel, otherwise حننتهي with a huge bleeding. لازم نسوي لايجيشن ولازم نسوي فتكوتري حتى يسيطر على البليدنج بالاريا. Tonsillectomy can also be used in surgical treatment of snoring اللي يعانون من الشخير. Significant debilitating snoring which can lead to acute or extreme social distress is related to obesity and in some cases tonsillar hypertrophy. Most surgical procedures for snoring involve modification and stiffening of the soft palate أو أحيانا يسوون عمليات تجميلية لليوفيلا بلاتوفارينجوبلاستي يسوون فد shortening للبالت and tonsillectomy. However, مع ذلك there is no good evidence that snoring surgery is beneficial. As a result of often poor and snoring reoccurs within 2 years of successful surgery in 60% of patients. Snoring alone is not an indication for tonsillectomy. Other tumors هو عندنا malignant tumors of the oropharynx. Malignant oropharyngeal tumors most commonly involve the tonsils. Squamous cell carcinoma is the most frequent histology and etiological factor, include alcohol and smoking. Tonsillar carcinoma often presents late with spread into the adjacent structure of soft tissue, even the base of the tongue and the mandible. And there is a high incidence of nodal spread, يعني يتحول إلى lymph nodes وإلى deep cervical lymph nodes at the time of diagnosis. Early tonsillar carcinomas can be treated by radical radiotherapy. More advanced cases need major surgical resection, which involves mandibular splitting for surgical access, excision of the tumor and adjacent tissues as mandible, pharyngeal wall, tongue, and comprehensive neck dissections followed by reconstruction using radial artery free grafts or pectoralis major mucocutaneous flaps. طبعا انت من ترفع التيومر لازم تاخذ سيفتي زون، ترفع الاجهزه ستراكشرز، وتضطر وراها ايضا تسوي عمليات تجميليه لترقيع هاي الاماكن اللي اضطريت ترفعها نتيجه التونسيلار كارسينوما. الانف نوز، تكلمنا على الفارنكس، الان حنتكلم عن النوز. The skin of the external nose and its surroundings contains many sebaceous glands and hair follicles which may become blocked and infected. The significance of this fact is that the facial veins, which may become secondarily infected, communicate directly with the ophthalmic veins and hence with the cavernous sinus. For this reason, this zone is often known as the dangerous area of face. وهي تعرفنا عليها بالتشريح بالمرحلة الثانية. The extensive relations of the nasal cavity are important in the spread of infection. Observe that it is in direct continuity with ويمن الأنف. خطورة الأنف هو its communications. So it's in direct continuation with the anterior cranial fossa via the cribriform plate of ethmoid and the nasopharynx through the pharyngo-tympanic tube of the middle ear, وأيضا paranasal air sinuses, and with the lacrimal apparatus الجهاز الدمعي والconjunctiva of the eye. وأيضا عندنا مشكلة أخرى هو the septum is frequently الحاجز الأنفي deviated to one or other sides, interfering with both inspiration and with the drainage of the nose and accessory sinuses. أول حالات علاج الأنف هو عندنا epistaxis النزف من الأنف. Epistaxis is defined as spontaneous bleeding from the nose, from the nasal cavity. And it is an extremely common condition, and most people will at some point in their life suffer from nose bleeding. The range of severity is vast, from a mild, self-limiting nose bleeding experienced by most of the people to severe torrential arterial hemorrhage that carries a significant mortality and morbidity rates. Epistaxis can be classified into two main groups, childhood and adult. Childhood إذن يقسم bleeding of the nose إلى نوعين, childhood bleeding epistaxis and adult epistaxis. A childhood epistaxis is common from the age of 4 and is characteristically minor but nonetheless alarming. هو minor ممكن معالجته لكن واحد يحط في باله ممكن there is hidden causes behind it. The nose bleeding occurs sporadically with predilection for nocturnal bleeding. The source of bleeding is usually the anterior nasal septum at a rich vascular plexus known as Little's area. Anterior nasal septum for the child epistaxis. And the management of child epistaxis includes pinching the nostrils over the soft lower lateral cartilages, which produces direct pressure over little areas. أول إجراء هو أنه تضغط على هاي المنطقة, فهذا البريشر will compress this vascular plexus. Once bleeding has stopped, some antibiotic ointment can be applied to the anterior nares to reduce any associated vestibulitis. Cutting child's fingernails can also help. أحيانا تطول أظافير الطفل ويلعب خشمه, فبالحالة يؤذي superficial blood vessels of this mucous membrane lining. Persistent or recurrent nasal bleeding in children should be referred to a specialist, which will usually lead to the offending blood vessel being identified and cauterized. يسوي له كوي لهذا superficial vessel فيصير به fibrosis. من يصير fibrosis يعني thickening over the blood vessel, وبالحالة الدمج مالته تقل. هاي الصور توضح لنا Little's area, هاي بالدايجرام, وهاي in real patient يراوينا Little's plexus which is the causative factor for child epistaxis. المشكلة هي بالadult epistaxis. Adult epistaxis can be potentially life-threatening condition which has a peak age of onset أحيانا يبدي بالعمر 60. And this type of epistaxis is characterized by a sudden unilateral severe arterial bleeding. Bleeding in adults often comes from arterial branches of the sphenopalatine artery in the posterior reaches of the nasal cavity. And this has led to the term posterior epistaxis. إذن childhood عنده anterior epistaxis بينما بالadult هو posterior epistaxis. This condition does not respond to direct digital pressure. هاي أول نقطة ممكن معالجتها بالضغط المباشر. And the management of severe epistaxis relies on the resuscitation of patient followed by attempts to identify the source of the bleeding. The nose is examined using a headlight, nasal speculum and suction. يسمون هاي التوسيعات للnostrils of the nose. It is often difficult to identify the bleeding point because of its posterior position. If the source cannot be found, otolaryngologists use endoscope to examine the posterior nasal cavity and identify the bleeding vessel, which can be then cauterized under direct endoscopic vision. Posterior epistaxis is usually managed by some form of tamponade using either specially designed balloon catheter or nasal packing. أحيانا يدخلون مثل البالونة ينفخوها حتى تسوي pressure على ال posterior position or posterior bleeding area. Admission to the hospital is required to search for the etiological factor. ممكن المراجع ياخذ aspirin or alcoholic patient or thrombocytopenia. Unlike childhood epistaxis, which is recurrent, adult epistaxis tend to be characterized by a single severe episode of bleeding. بالchildhood epistaxis يكون متكرر بينما usually in adult it is a single episode. هاي الطرق اللي يستعملوها أحيانا for posterior pressure على الكوزيتيف بليدر. هاي هنا يستعملوا مثل البالونة يدخلوها إلى البوستيريور region of the nasal cavity ثم ينفخوها فتسوي مثل بريشر على البليدر وبالتالي تخفف البليدنج وتسيطر على البليدنج from the blood vessel. Septal deviation. السبتال deviation هذا واحد من العمليات المهمة والتجميلية اللي يسويها ال ENT specialist. The quadrilateral cartilage of the septum may be fractured, resulting in a septal deviation that can give rise to nasal obstruction. Characteristically, this produces unilateral nasal obstruction, and the examination reveals a convexity in the septum touching the lateral nasal wall. The unilateral nature of the symptoms helps to distinguish this from rhinitis. Treatment consists of operation septoplasty, which resects and straightens the quadrilateral cartilage, perpendicular plate of ethmoid and vomer, and thus recentralize the septum. يسوي له كسر للسبتم ويثبت مرة ثانية حتى يسوي recentralization of the nasal septum. ومثل ما تشوفون هنا بالصور شلون يصير عندنا multiple deviation of the nasal septum وشلون يكسرون النازل septum in order to reconstruct it. هاي الصور توضح لنا الديفرنت شلون هنا يصير عندنا nasal deviation toward the left side وشلون احيانا من يكون severe يسوي لك nasal obstruction characterized by a unilateral nasal obstruction. من الحالات المرضية الأخرى اللي يعالجها ENT specialist هو النيزل بوليبس، الاستطالات الأنفية أو الزوائد الأنفية. Nasal polyps are inflammatory masses that originate predominantly from the lining of the ethmoid sinus. Polyps are most common in patients with asthma اللي ينعانون من الربو. In a proportion of patients there is an association with aspirin allergy. Symptoms are similar to severe rhinitis. With total nasal obstruction, the hyponasal speech and the nasal discharge من علاماتها والsymptoms المصاحبة إلها. Diagnosis usually easy on nasal expansion. The polyps should be referred for the specialist assessment to exclude the tumor. Topical or systemic corticosteroid medication can shrink such polyps, but surgical removal is often required, followed by topical medication to prevent recurrence. هاي الاستطالات الأنفية تؤدي لك أيضا إلى nasal obstruction, thickening of the turbinate، هاي الكونخة السوبيريور والميدل والانفيريور كونخة اللايننج يصير بيها thickening فتسوي لك nasal obstruction. لذلك you have to resect such polyps and remove it to permit for proper inspiration. فيتم قلع such polyps from its lining ويقللون من النيزل obstruction اللي يصير واللي يعاني من عنده المراجع. إلى هنا انتهت محاضرتنا. شكرا جزيلا وبارك الله بكم.